Thursday at 11 at
But I
night.
said,
It's been like this for days now. Because I need to restart.
I was gonna say, that means you're like me, and if I have my work, but I know, it's
Such a pain to shut everything down. We'll try that tonight, though.
Yeah, every now and then when it starts doing funky stuff like that, I know, okay, Paula, you gotta make yourself shut it down. Oh, that's funny.
Yeah.
Oh, I didn't join this. I have a really stiff mask on, and I feel like it is blocking half of my face. I don't know.
Pinch me just so
Very
much.
short.
I can't imagine with glasses. Eric, can you promote me too when in second? Yeah.
Good evening, everyone, and welcome to the January 24th meeting of the Ames Community School District Board of Directors. I'll call the meeting to order and entertain a motion to approve the agenda. So moved.
Second?
Moved by Smith, seconded by Franzen. All those in favor say aye.
Aye.
Opposed, nay. Passes 7-0. Director Becker, will you read our purpose statement?
I will. The Ames Community School District commits to equity and access that empowers every individual to reach their full personal and educational potential.
Thank you. Just to give a heads up to anyone who is watching or in the room tonight, if you would like to speak as part of our public forum, we invite you to sign up to do that. You are required to sign up at the start of the meeting. So we have a sign-up sheet in the back of the room here, or there's this link on the Zoom. If you were in our Zoom call, you can click that link and sign up. We will leave those open for about 5 more minutes. All right. Moving on to our first agenda item, we have our COVID-19 update and Dr. Kathy Arnold.
Good evening, board.
Good evening.
Here I am again with a COVID update. As you see on our first slide, Story County remains at a high level of community transmission. The most recent CDC numbers at the time I prepared the report are as follows. It's at a high level of community spread with 1,011.5 total new cases per 100,000 persons in the past 7 days, which is about a 595 case increase from the report at our previous board meeting. Another way to describe the increase is that the current case rate is about 2.5 times higher than our previous report. And unfortunately, these case numbers likely represent underreporting of positives because of either people not testing or people using the rapid home tests, which don't then get reported through to the state. I've seen this myself with staff as well as student positives reported through rapid tests. As far as positivity, the 7-day positivity is 34.74, which is about a 10% increase over the past report 2 weeks ago. As far as the last IDPH report last Wednesday, 19% of the new cases in Story County are in those 0 to 17 years of age, up 9% from our previous report. The graphs you see include the data through January 17th, which is the last IDPH reporting window. Initial reports and from listening to some CDC calls are that in general, the surge may have peaked nationwide. However, Iowa runs anywhere from 10 days to 3 weeks behind, depending on lots of different factors. Currently, as far as vaccinations, 61.7% of Story County residents are fully vaccinated, which represents about a 0.5 point increase from the last report, and an additional 5.4% are partially vaccinated. Of those who are vaccinated, 52.7% of those vaccinated have received their booster, and if you narrow that to those 18 years and older, 57.1% are fully vaccinated with the booster. Our next slide includes our student and staff data. At the time the report was prepared, we had 47 students and 9 staff members currently positive for COVID-19, which is pretty much actually in line with the report 2 weeks ago. However, down from about 10 days ago, where we saw 90 students positive and over 20 staff positive. Luckily, our teacher workday and the holiday weekend gave a little bit of a 4-day decompression and probably saved us some transmission. We have had a total of 585 total students positive this school year, and 385 of those reported since winter break. So definitely that Omicron surge. There have been 122 staff members positive this year, 84 since winter break. The next slide includes some information from Mary Greeley. I just wanted to share other resources for our information. Mary Greeley does share the hospitalization amount of people positive for COVID on a weekly perspective on Mondays. And I'm cautiously optimistic with the report from today that we are down from 31 last week to 13 this week. And around when we had our peak about 10 days ago, Mary Greeley had about 40 patients hospitalized for COVID-19. So again, we hope that this is a trend downward. However, there's some discussion, not really sure what the impact of Iowa State being back is going to do on numbers. So we're kind of a little bit at a wait and see on that. As a reminder, at our previous meeting, I had shared that it was the next 4 to 6 weeks we're seeing an increase. So an update on dates, that's the next 2 to 4 weeks, if it makes it sound more palatable. But hopefully that, again, as predicted and as seen in South Africa and other countries, we're starting to see hopefully that decrease. On the last slide, you're going to see some other COVID-related updates. We had our booster clinic last Friday night, January 21st. We gave 123 booster doses for those 12 years or older. So we had a mix of staff as well as students at that clinic. We may schedule an additional one if there is request or interest in the community. The boosters, though, are still available at most pharmacies. McFarland and Story County Public Health in their office has many, many open appointments that they said that they can fit people in. And a reminder, booster doses are recommended for at least 5 months after completing the primary COVID-19 vaccination series. And just the final topic is on our OSHA ETS. As a reminder, the OSHA ETS that would have required staff who were not vaccinated to test weekly for COVID to test on a weekly basis. And as reported at our last meeting, Iowa OSHA said they weren't going to adopt or enforce the federal OSHA ETS. We stated at that time we had paused our activity on movement towards following that. We did approve the IASB policy at the last meeting with a clear contingency on the policy that said the following is effective so long as the federal OSHA ETS on COVID-19 vaccination and testing is subject to enforcement by the federal and or state government. And since the Supreme Court ruled that the OSHA ETS was not moving forward, subsequently our policy was not implemented. Email communication was sent from HR to all staff as an update, communicating that, and that the related policy is no longer in effect. And that completes my report. Please let me know what questions that I can answer for you.
All right, no questions from the board. Thank you, Dr. Arnold. Do we have any comments from the public on our COVID-19 update?
Hello, Christopher Kasak, 5616 Maryland Street. And I see some of you have updated your masks to the KN95. Very good, which leads me to my next, that cloth masks are not effective, as I've been saying, as now the CDC says, as pretty sure most doctors are saying, which from what my kids tell me is what most children wear. It's obviously not working, as I've gotten email after email, 14 kids positive these days, this many faculty and kids these days. So I don't understand why we're still masking, especially with cloth masks, and there's no validation for kids for the KN95 mask, so it's not really that we could put them in it even if we wanted to, because there's virtually no danger posed to children. At this point, it just is facial decoration for the kids, and they're still getting it either way. And we have no studies on if it affects the kids' learning, if it affects the kids in any negative ways, but we do have studies saying that the cloth masks don't work. So it feels weird to weigh it that way, to where we know that they're not working at all, and we don't know if there's any negative effects from it, but we're still keeping on the same path of what we've been doing, which obviously isn't working. So that's all I have to say. Thank you.
Thank you, Christopher. Any other comments from the public on our COVID-19 update? We will move on to our next agenda item, which is our board committee updates, and we will start with the equity committee.
We had our first equity committee meeting of the year. We spent most of the time just discussing how we're going to proceed with the committee, basically a structure where Anthony is going to be leading, where there'll be an update. Well, we're going to have a meeting every month. Anthony will give an update about what's been going on in equity from his perspective, from his office. And then there'll be a topic of interest that he'll bring forward, some bigger topics. Like next time, it'll be around the equity report and probably definition of educational equity. Although that might just come to a work session. I think that's still to be decided. And then the other thing is there'll be some, as possible, trying to have something from staff, students, somebody in the district about something that's going on in equity, like a specific item, and really have a pattern for that and a pattern of reporting. And that's where we're going with those things.
Thank you. Other board committee updates? I guess I will share that the mental health committee met today. Because we met today, it wasn't able to be on the agenda since the agenda is posted ahead of time. So I will give a full update on that at our next meeting. All right, any comments from the public on our board committee updates? We will move on to our teaching and learning update. And we will start with our ESSER implementation and spending update. Sorry, Dr. Hawkins.
Good evening, directors.
Good evening.
Good day today.
Yes.
Well, I'm excited to be able to share some information with you about our ESSER plan and an update around data around the components addressing learning loss. I did think it might be wise to just review generally.
Yeah, I thought I was projecting, maybe not. Is this okay?
It doesn't get through to the online folks.
Yeah, okay.
Yeah.
My apologies. Again, I thought it might be a good idea to begin with a brief review of the ESSER plan. What is ESSER? What is our plan? What are the requirements of the state? You know, we've had some change in board leadership since this was discussed this summer. Thought that might be a good place to start and then get into some of our data. So just in a broad overview, what is ESSER? On March 11th, President signed into law the American Recovery Plan, which authorized that elementary and secondary school emergency relief fund, which is what we call ESSER, or ESSER 3 specifically. That allocated a number of funds to the state and then, of course, to the district as well, that was really designed to help make sure schools stayed open, to sustain the safe operation of schools, and to address the impact of coronavirus on students. Specifically in ESSER 3, there was a component of the law that asked us or directed us to spend a certain portion of that allocation on learning loss. So the four required areas addressed in this plan were to spend money to address implement prevention measures or mitigation strategies in order to continuously keep schools open and safe for students, to use funds to address the academic impact of lost instructional time. That was a key component, right? So there was a time component to this. So please do some sort of extended school day, some summer school opportunities, and you'll see in just a moment that those are two strategies that we did use. A broad category of number 3, using those funds consistent with any of the other acts that are attributable to the law. So we could spend it on the Elementary Education Act, the Secondary Education Act, Perkins funding, all those other federally authorized ways to use funds. It's a very broad category. And then that last criteria, number 4, ensure that the intervention implements will be responsive to the academic, social, emotional, and mental health needs of all students, particularly those students disproportionately impacted by COVID-19. Examples, students from low-income families, students of color, English learners, children with disabilities, students experiencing homelessness, children in foster care, or migratory students. So the law itself set aside not only spending money to address learning loss, but even some targeted population of our school that would receive those funds. So we used a process within the district in order to come up with a plan, right? So we first started by collecting input of our staff members. What were some ideas and strategies for how to spend this money that they thought would align with the guidance of the federal and state governments, right? Then we formed a committee formed of staff and community stakeholders where we met multiple times in order to review some data, in order to ascertain what does our local data say about where our funds could be best leveraged, particularly around number 4, right? And then to provide input on the interventions that had been suggested by staff. Which of these interventions were suggested by staff, targeted towards the groups that our data would suggest are needed, and then aligned to the research base. So the committee really focused on those. Once we identified those strategies that we wanted to spend funds on, then we opened that up for public comment and public input. We considered that public input and then gave a presentation to the school board over the strategy, submitted the plans to the state, and began our implementation process. So a pretty broad overview of that plan, right? Again, you'll see the correlation of the way this is submitted here for you related to those 4 areas, right? Prevention and mitigation, extended time, other acceptable uses of the fund, and then interventions. So in the prevention and mitigation strategies in our plan to our community, we talked about things like cleaning supplies, hand sanitizer, PPE for our schools, nursing to make sure that we had a full-time nurse in all of our locations, and the funding of our emergency management coordinator. For the extended time, we did discuss, as I referenced earlier, the idea of summer school and after-school tutoring. I'm going to have some data to share with you about those strategies in just a moment. Other acceptable uses of the funds, there are many, but the one that I want to share some data with you about tonight is around Edgenuity. We're using some of our ESSER funds to fund that Edgenuity option. And then some of the interventions I'm going to detail in the next slide. So some of the interventions that were identified, again, staff suggested, research-based, targeted towards the population shown in our data, was the expansion of Americorps Tutoring. For those that aren't familiar, Americorps Tutoring is out of the University of Minnesota. It's a research structured literacy way to improve reading scores for students that are behind grade levels. Goes K through 3 is primarily the strategy. I will tell you, our desire was to have Americorps in every one of our buildings. We worked with the United Way, who is a great partner with us, to try to find 10 Americorps tutors. Unfortunately, we could only find 5, just like every other place in the nation that's finding difficulty finding bodies. We found difficulty finding these bodies. And since that 5, we've had at least 1 that is not going to go through the year. So we're down to 4. So I want to be transparent with the board that we didn't quite reach the target that we'd hoped for in getting into every building. But I have some data to share with you again in a slide in just a moment about the success of that intervention. So we'll want, in my opinion, we'll want to continue to try to find more tutors for this particular strategy, because it's proving to be extremely effective with the students that it's being used with. After school tutoring services. So you may remember that this fall, we began an after school tutoring program for our students. Again, I have a slide where I'll share with you the data of how many students we served. I'm going to give you a little preview of that slide as well. We are waiting on MAP testing results that are actually occurring right now in order to get our, so we have our baseline data. We're waiting for our math testing results that are occurring right now in order to get kind of the progress monitoring data on that intervention. I'd be more than happy to come back here in a couple of weeks and share with you how that's going. And then we have summer school data. We offered summer school to our K-8 students based upon data around reading assessments, and then our 9-12 students we offered credit recovery opportunity. And I've got some data to share with you about the number of courses passed, the number of students that are graduated as a result of that. So I've kind of tipped my hat when it comes to many of these data sources, but I wanted to show you for Americorps Tutoring, again, I had already kind of referenced that we would hope to have 10 tutors. We had 5/4 tutors. But you can see of the 64 students served, I guess I'm going to direct your attention to that second to bottom line. 86% of the students being served have a trend line of positive growth. So it's a really strong, I mean, the research base would have said the same thing, right? It's amazing how oftentimes life actually aligns with research, but the research base would tell you that it's a strong strategy, and it's proving to be a strong strategy. Again, if we can continue to find, maybe this would be my pitch to the community who's listening. If you're interested in Americorps Tutoring, there's a training program that is rich. There's in-house mentor that works with you. It's a really effective strategy for our students, and we're getting really good data from that. When it comes to the after-school tutoring program, again, I kind of already tipped my hand here as well. We're looking for, we need the data from our next round of MAP assessments to be able to provide you as a board that same kind of data. What percentage of our students are experiencing growth as a result of this intervention, right? That data is being collected currently. What you can see is the number of students that were served, 138 students total. You can see that elementary students as well as middle and high school students were served with this intervention. And I can tell you as a board, we plan to repeat this intervention this spring. Beginning, it's either right now or shortly, we've identified a set of students that will begin math tutoring as well. I believe that's only with our elementary students. So in the next time that I give you this report fully in the spring, I should be able to give you updated data around math tutoring as well. And then from a summer school perspective, again, you can see here the number of students that we had served. 125 total students went to 9 through 12 summer school. They took a total, they earned a total of 263 credits. 11 students were actually able to complete their high school diploma by going to summer school. That's fantastic. Again, just a brief tangent. There's tons of research out there that would suggest the lives of our students are greatly improved by completing their diploma. And so I'm extremely happy. This is, in my opinion, again, money well spent when we're seeing students get back on track for graduation and completing their diploma through summer school. There are also some components of the plan that, as I presented them earlier this summer and fall, I indicated to the board, there were some components of the plan that we wouldn't have data on for a little while. It takes a longer time to implement professional development and then get subsequent data on the impact of that professional development, right? But I wanted to outline some of the components of professional development that were written into the plan that are currently going on. So piloted in one elementary with a small group of teachers, language essentials for teaching of reading and spelling, letters training is occurring for our staff. It also is an extremely highly researched reading intervention strategy. It's a structured reading strategy. It actually is endorsed by the National Association, excuse me, for dyslexia. And so it's proven to be a really effective strategy. That will be one where I'll be interested to see how does our data come and what might our expansion of that strategy look like, assuming we get the data results that research would suggest we will. Another strategy addressed in our plan was the purchase of formative assessment software for math. For those of you who remember when the data was presented, secondary math came out as an area of emphasis. This is used in our secondary schools. particularly, it allows teachers an easier way to check on the progress of individual students or a whole class. And then there's also opportunities within the software for them to produce problems that students can work on targeted to the area of that formative assessment. So it's a nice option for our teachers to collect information and then provide intervention. I don't want to mislead the board in any way, shape, or form. The software itself is not an intervention. The teacher's use of the software is what is the intervention, but anytime we can get better data into our teachers' hands, the better job they can do of intervening as they see needed. And then currently occurring in our district is Sheltered Instruction Observation Protocol, SIOP training. The research base around this is particularly strong as it relates to our EL students. And that was some of the targeted population that we wanted to use this strategy for. However, as the research base would suggest, as well as the professional development from this company would suggest, schools that use this see benefits in all of their students, not just the targeted population of EL students. But it really takes research-based proven strategies around 8 different components of lesson plan, lesson delivery, engagement of students, and lesson assessment, and gives teachers applicable strategies that they can use in their classroom to address those learning needs. Again, it'll take some time for us to see the impact or the data around these professional development efforts. But I would say, I think when we see other strategies that have a strong research base giving us the results that we would want, it gives me hope and confidence that we'll see similar results from other similarly research-based strategies, which, by the way, was the whole point of that portion of the law, suggesting that you had to use strong research-based interventions. Before I go on to the next slide, I do want to remind us as a board that the Edgenuity data that I'm going to share with you is not a part of our learning loss plan, right? So we are using ESSER funds to help support our Edgenuity program, but it's not because we believe Edgenuity is going to help recover lost learning for students. If you remember from that first slide, it was that other use of funds, but we have data around Edgenuity, and I feel responsible to share that with you in our community, okay? Here we go. Okay, so how is Edgenuity going? So this is how it's going in our elementary. We began the year with 45 students in our elementary program. If you remember, we had some capacity issues based upon our provider and how many seats that they would provide us. We ended the semester with 35 students. Some families chose to go back. We had that request and were able to accommodate that for in some situations when we were able to institute a mask mandate. You can see that those somewhere between 45 and 35 students took 174 courses. They passed 111 of them for a 64% pass rate. I would tell you that is significantly lower than the pass rate of students in our buildings. You can see that of those 174 courses, 75 of them were either on or ahead of pace, and 99 of them were either behind, were not on pace, they were behind pace. Of those 99, 38 of them were significantly behind pace. So the software itself and the process allows us to see kind of what that progress looks like. And so I think this data is one, maybe I'm getting off into tangents that I shouldn't, but I think it's one that we should reflect on about our provision of online programming. How's it going in our secondary system? We served a total of 69 students in the secondary portion of our Edgenuity. They took 355 courses and passed 135 of them for a pass rate of 38%. You can see of those 355 courses, 102 of them were either on pace or ahead of pace, and 253 of them were behind pace, 64 of them significantly behind pace. Again, that is less than half of our typical pass rate of classes taken on site in the building. Anecdotally, I would tell you that going into second semester, there are 12 elementary families signed up for Edgenuity. And so we're seeing the desire of our community to access Edgenuity at the elementary level decrease significantly. The converse is true at the secondary level. We actually have over 90 families signed up for Edgenuity at our secondary level. And so we're seeing secondary families being more drawn to this option. I would add, just because I would anticipate the question, we have added some additional support for our secondary system for second semester. That is my presentation over just a broad summary and some of the data specifically about how we're using ESSER funds. Again, some of that data is to come, and I fully would anticipate you as a board may want me to come back in a few weeks when we have that data and let you know how the tutoring is going, so on and so forth. But that being said, what questions could I answer for you?
First, really simply, are these data effective or as of January 10th, 2021 or January 10th, 2022?
2022, sorry for the
Okay.
typo. Good
Just
catch.
wanted to make sure.
Yeah, good catch, yes.
So Jeff, can you remind us with the ESSER meetings we had, what were the identified target groups?
Right, so if we were to focus on elementary schools, it would have focused us towards Mitchell and Sawyer. If we were to focus on academic areas, it would have looked like reading in the elementary and math in the secondary. And what came out of it from a data perspective was focusing on Black students, homeless students, IEP students, and EL students.
So then, as you look at the various areas, the Americorps, the school tutor services, and the summer school, how did we make sure to, target's not quite the right word, but make sure that we represented students from those subgroups as well as we could?
Sure. Well, that's an interesting question because we use the data around student performance to pull students into like after school tutoring or to summer school opportunities. Now, as we've reviewed in several different situations, I will say unfortunately, but it is true that our data would reflect that there is a gap in an opportunity gap between the performance of our students of color or on all of the identified groups that I just talked about and other students. And so I would have to go, but I mean, I think some of this really spoke to how many students of color were served, how many low SES students were served, IEP students, so on and so forth. But I'd have to go back through, and I could bring that in when I come back to the board to talk about how was that, did we make any choices about that? Like, did we include or exclude any students specifically targeted towards those groups? I'd have to ask some other questions of the people who sent the invites, to be frank with you.
I guess the reason I asked is it sounded like when you're going through the presentation and looking at the screening seemed to be based on performance as opposed to performance combined with making sure to target those groups that had already been identified. Is that because basically the two things lined up already?
Well, yeah, we know that they do because of the data that we've reviewed.
Okay, so we did make sure to target those groups. We didn't.
But if you'd like a more intentional answer, then yes, those groups are also shown through our data. I could go back to see if we, made some of those choices, like, oh, we've got some students here and some students here in parallel data sources, and we have limited resources. And so did we invite, I would have to ask some more questions to be able to answer that question for you.
Okay, I don't know the scope of effort to find that out, but I know that's one thing we had talked about when we kicked off the ESSER work was really to definitely go after those targeted groups as much as we could. So just, I'd like to make sure we did.
Yeah. I definitely feel like, and at least we previously had gotten feedback from the board that the plan itself was including strategies that were grounded in a research base to target the student groups that would be effective as per, the community feedback and our data. But to be able to answer this specific question with more intentionality, I'd want to ask some more questions about beyond using our data to identify students, what other strategies we might have used.
Okay, thank you. And it looks like, as you said, the research-based strategy seems to be paying off and doing really well. So I'm
really
very
excited.
pleased with the results.
Yeah, I'm really excited about some of our results. I'm really anxious to be, and maybe this is not my place, but I'm really anxious about our Edgenuity results. I'm excited, there's some of the results that I feel like are pretty strong, and that's good because the results that I'm excited about are the ones that we targeted towards learning loss. So that's a great thing. But I think we have some things to consider as a system particularly when it comes to the provision of online learning.
Dr. Hawkins, along that line, do you have any ideas why our enrollment is up for the next semester for the secondary Edgenuity when the number of courses passed is such a low percentage and the number of courses behind pace is such a high number?
I don't have a way to connect those two as to why there's an increased demand.
Yeah. Do we know if those who are enrolling for the next semester are aware of these numbers?
I would venture to say that they're probably not, because I don't know that we've made these public before tonight.
Right.
Certainly if we have families that would see this and say, oh my gosh, that's not what we want to do. We want to be in classes. We're at a stage where we can still make that happen.
Yeah.
But yeah, this is so anecdotal of an answer. I usually am not, I try not to be anecdotal. My experience in speaking with many families who are interested in online options for their children at the beginning of the year, it's maybe a little bit different, but I'm trying to be fully transparent. Many of those conversations did not center around whether or not they felt that this was the best educational option for their child, but whether that was the best health option for their family.
Got it. Yeah.
I'd be curious to know if there's any way to find out why people are making that choice to do online, especially at the secondary level. And I wanted to ask, you mentioned adding additional supports and that's for the students that are doing the Edgenuity. What were those additional supports?
We've added, thank you. We've added a staff member who is working specifically with secondary students to track and prompt attendance, so we've had other staff who had this responsibility, and I certainly don't want to give the impression that they weren't fulfilling this responsibility. It's just that they were other staff who also had other responsibilities in the building with other students. And so they're kind of they had more plates spinning, if you will. We have a staff member that is dedicated to just those Edgenuity students second semester who can track attendance, problem solve, offer tutor. That's a licensed teacher who can offer tutorials, who can do home visits, meet with families, problem solve. And so hopefully we'll see better results with increased attention to that.
Thanks.
But I don't want to pull any punches. The responsibility for day-to-day instruction and work is still one that places that responsibility more independently on our students. And I guess I want to articulate that because that's my primary concern with an educational. I mean, not every, I've got 3 kids myself. I've got some kids that probably could handle independence pretty well. I've got some other kids that I would be more concerned with. And I'm not sure that this level of independence is the best overall option for all students. And it makes me wonder with these pass rates, if it's a system.
And that's why I wonder why more folks are choosing that, because if there's a reason they're choosing that that we can address, right, to keep them in the building, then I think that probably would have better outcomes.
Yeah, we have always we've done this 1 year. We have approached this from the perspective that if you're wanting to do something through it, if you're wanting to take Edgenuity, but Edgenuity doesn't offer something you need, you're welcome to come to the building for that. Mm-hmm. We haven't extended that thus yet at this time to Edgenuity's does offer this, but you still want to come to the building for maybe a specific course that you would struggle in. But some of those might be some strategies that we want to consider in our approach to, again, our purpose. I apologize if I'm tangenting too much, but our initial purpose, as we discussed as a district and a board and a community, was to provide an alternative pathway for students. It really wasn't about safety or COVID mitigation. It timed out nicely and it worked really well, particularly when the Delta variant was raging in the fall and we needed another option for students and families. But our original intent, as I recall, was to provide an alternative option for students who just didn't work, going to a comprehensive setting wasn't working for them. We wanted to provide another option. This year, it's kind of morphed, in my opinion, and in the conversations I've held, to a safety and a COVID mitigation strategy. We're going to continue as a growing system to have students who a comprehensive setting doesn't work well for. And I know we all feel a responsibility to figure out answers for those students. I really question whether or not this particular answer is a long-term answer for us.
Yeah. So the data that you've given us are for all students, regardless of whether they were funded through ESSER 3 funding, or are all of our students in Edgenuity right now funded through ESSER 3?
Yes, the latter, yes.
Okay.
Yeah, all of Edgenuity is funded through ESSER 3.
Okay. And so this is effectively one-time funding, so it will go away in the future then?
Correct, yes.
How much have we spent on this? What portion of our ESSER 3 funding?
That's a
I
great.
do want to, we probably should just refer to it as ESSER as opposed to ESSER 3.
Okay.
The learning loss piece is specifically out of ESSER 3, but right now we're still spending ESSER 2, and we have to spend that before we can spend the rest of ESSER 3. So we actually paid for Ingenuity out of ESSER 2.
Okay.
I believe that the secondary portion was 85,000-ish
For
for Ingenuity. And
Yeah.
the elementary was 40-ish, somewhere there. I could look it up,
Yeah,
but
my recollection, it was close to around 160 to 170 total for both, I believe.
that'd be about right then. Eric, if you could pull up the other attachment that's with this item.
Sorry.
Oh, I'm sorry. I didn't know he didn't have his computer. So as Eric is pulling up this, we have received to date 4 different funds under what was the CARES Act originally, and then the American Rescue Plan. We received ESSER 1, we received the Governor's Emergency Educational Relief Funds, which was primarily for connectivity for the internet. We've received ESSER 2 and we've received ESSER 3. And again, we have to spend ESSER 2 before we spend the primary amount of the ESSER 3. If you look specifically in August under ESSER 2, August and September, those 2 big numbers are really where those Edgenuity things came in. And in ESSER 3 under the learning loss, you're going to see those first couple of months of the summer school, and then as we started getting the after-school tutoring ramped up. So at this point, with what we have spent and what we have encumbered as far as salaries and benefits for the rest of the year, it looks like we're going to end the school year with approximately $300,000 to $330,000 of ESSER 2. As a reminder, for ESSER 2, we have until June 30th of 2023 to spend that. And for ESSER 3, we have until June 30th of 2024. So while it is one-time money, and we do have to be aware of that fiscal cliff, it's a long fiscal cliff as opposed to most one-time money, which usually you only have for 1 year. I will tell you that there are, and then the first couple of things of ESSER had money for the non-publics, and then they finally decided that wasn't working, trying to have that go through us, so they kind of took them out of the mix. There are 2 more pieces so far. I would expect there'll be more as the governor continues to figure out how to spend her portion of the American Rescue dollars. We have received just under $30,000 allocation under the American Rescue Act, homeless youth and children. That money should be available starting this quarter. I was told if we spent part of it in December, we could still claim it. That, if you recall, we had lost our McKinney-Vento grant that had funded our homeless liaison. So we were funding our homeless liaison out of ESSER 2. And this new funding specifically is for a homeless liaison. So we'll be moving that, and then that'll free up a little bit of ESSER 2 funds for that. And then later on the agenda, you're going to see, and we'll talk a little bit more about that, the governor's putting some ESSER 2 money in for some preschool enrollment increases, and that's an action item, and I'll talk about a little bit more. I would anticipate as we go through, I know my guess is the $1,000 retention bonus that the governor has in her budget plan. My guess is that's going to be ESSER funds. So my guess is we'll get little pieces of this for the next couple of years. But at this point, the bottom line, if you go up just a little bit, Eric, it looks like we should end the year with about 3.9 million of the 5.9 million that we originally allocated left.
Okay, thank you. So do we have any information about the demographics of students who are taking Edgenuity?
Yes, I can get you the demographics of the students that are taking Edgenuity,
Yeah.
yes.
Because I wonder how it aligns with our target populations. I know that our target populations are specifically for learning loss.
Yeah.
But,
Good.
I mean, it's also relevant to wonder how this relates to the target populations that we say. And if we are disproportionately hurting, if Edgenuity is hurting or is not benefiting students as much as other forms of education are, and we have issues with it aligning with our target populations, and this could be an issue.
Can I paraphrase that to make sure that as
Yeah.
I bring you the data, I'm getting you what you need? What I think I heard in that is we want to look at the demographics of the students that are using Edgenuity, noting that the low pass rates, we would want to make sure that we don't exacerbate an opportunity gap that already exists by seeing an overrepresentation of a student group that is already seeing a discrepancy in data.
Yeah.
Thank you.
I would like to see that data too. Thank you, sir. Yeah.
I appreciate you saying, I know that we're not addressing Edgenuity for learning loss. I think it gets to Director Winfrey's question as to why are families choosing this. Again, with the relatively small number of families at the elementary, I can speak relatively confidently that it is a health-based option. But with the expansion of students in the secondary, we're going to want to do some digging before we make assumptions and bring that back to you as a board.
Anything else from the board on the ESSER 3?
I have another question about something briefly that Chris just said that I was surprised. I had thought that I had understood from some previous training or something that we weren't allowed to use the ESSER 2 or ESSER 3 money for salaries, but maybe I misunderstood something.
Oh, no,
or teacher salaries.
Oh, no, we absolutely can. The original language in both of the CARES and the American Rescue Plan listed all those different things that Dr. Hawkins mentioned that we could cover, the mitigation and so forth, as well as anything in those title programs that he listed, including the McKinney-Vento grant. But then the catch-all on it was anything that you could spend it on anything to ensure the continued operation of the school district.
Okay.
So we did do salaries for the most part for the teachers. The salaries and wage-based benefits were the summer school.
Okay.
This year we did, because we weren't sure if our enrollment was coming back, we do have 2 elementary sections that we did fund with ESSER. But for the most part, it has been the addition of the nurses.
Okay.
Which are part of the teachers group. They're just not certified teachers. But yes, we could totally supplant this. The only thing they really came out and said that we can't do is pay for the superintendent.
Okay.
If I remember correctly, though, I think I know what you're talking about. It was related to the learning loss
I was just going
intervention strategies, that a
Okay.
teacher can't be an intervention strategy.
Okay.
Am I saying that correctly?
Two points of clarity there. Well done. Yes. Unless a teacher is implementing the intervention is like the research-based program. And so we can't use funds to hire a teacher and count it for learning loss. So that's the key. So
Okay.
Of that ESSER 3 allocation, we must spend by regulation 20% of those funds towards learning loss. That equates to roughly $720,000 worth of spending. So that of the 5.9 million, 720,000 could not be spent on staff unless we could show that those staff were day in, day out implementing those research-based strategies.
So for instance, summer school was a research-based program. The salaries and wage-based benefits for the people that were teaching in summer school are covered. But you're right, I'd forgotten about that one piece. We can't just hire a teacher and say they're going to go teach all the other teachers how to do interventions. It has to be for the intervention itself. But we could use the other part of the ESSER funds to do that if we wanted to.
We could use $5.2 million to do that. We just can't spend the other 700 on that.
Yeah.
Are there other questions that I can answer for the board?
All right. Thank you, Dr. Hawkins.
Thank you.
And thank you, Chris. All right. We will go on to our second teaching and learning item. We will at the end of the item. So after the teaching and learning item is complete. So the therapeutic classroom grant update. And Deanie Thomas. Hello.
All right, so I just wanted to give a quick update about our therapeutic classroom grant that we received back in June. So this first slide just tells a little bit about what our grant application involved. So our grant was to refine our existing services and supports for students with social, emotional, behavioral health concerns, specifically at the elementary, the K-5 level. So not so much our secondary, middle school, and high school yet. So in this district, we refer to our SEBH or social emotional behavior health services as integrated services. So you'll kind of hear me use that maybe throughout. Our plan was to improve our structures, our practices, our professional development, to really embed some more research-based strategies like cognitive behavior therapy, trauma-informed practices, and so on into our services provided in schools. We have collaborated with Central Iowa Psychological Services and Heartland Area Education Agency to try to just refine our practices. This does not mean that our teachers are becoming therapists. Just want to make that really clear. Sometimes I think the language is a little bit confusing. That's not what we're talking about at all. We are borrowing from some of the lessons in other fields and bringing those into schools, but not expecting our teachers to become therapists. So our grant application involved 3 major goals. So you can see them there. The first goal was for our staff to align their practices with the formal professional development that we've been providing and the embedded professional development throughout the year, to make sure that we are implementing our services with integrity in the ways that we say that we're implementing our services. And then throughout the year, this last one is just kind of a really long way to say improving the conditions and quality of life for kids. So the students that we've served, our grant was actually for 3 classrooms or up to 30 students across the elementary level. We have served 39 students so far this year who have individualized education plans for special education services. We've served 5 students who do not have IEPs, 5 students who are tuitioned in from other districts, for a total of 49 students in our integrated services programs at the elementary this year. And this is just kind of a laundry list of our first semester accomplishments. So we've trained 37 staff members in cognitive behavior therapy with the Beck Institute. We offered that before school started in August. All of our principals, student family advocates, instructional coaches, behavior interventionists, counselors, integrated services teachers, and then integrated services educational associates are fully trained in Crisis Prevention Institute training for de-escalation both verbal and then the physical restraint and seclusion. They're all certified. We have monthly meetings with the Central Iowa Psychological Services to support our practices and provide that embedded PD. The SIPS professionals also have visited each of our buildings to provide some modeling and feedback and support for our teachers and other staff. If we look at some of our other data, one of the key pieces of data for kind of those second two goals that I talked about is our alignment between our behavior intervention plans, our functional behavioral assessments, and our individualized education programs. And as of December, the end of mid to end of December, we were at 91% alignment. Our behavior interventionists have been participating in a book study around trauma-informed practices. We saw a 16% increase in the use of trauma-informed practices between October and December. We've hosted 2 community mental health awareness open house nights, and we have distributed a monthly mental health awareness newsletter to schools and families in multiple languages. For second semester, our focus will be on the application of our professional learning practices with students, using the resources that we've been purchasing through the grant. So we've been building, for example, a mental health library that we can loan out to kids and parents and teachers. So using those kinds of things and some of the other equipment, sensory equipment and such with students, analyzing the student data to assess the efficacy of our programs and then adjust as appropriate, of course. Expand targeted consultative support from SIPS. They've really been supporting us in more of a general way, so we'd like to get a little bit more specific now that we know the kids that we're serving a little better and have a little bit better capacity among our staff. We want to identify and expand the wraparound services that we can help connect students and families with to continue to support their social, emotional, and behavioral health. Evaluate and continue to refine our elementary services moving into next year, and then plan for the transition for preschool students into the elementary and for elementary students into the high school. So that was my very quick update. What questions do you have?
I don't know if you can answer this, Deanie, but hopefully. Sure. So you have 37 staff members attended cognitive behavior therapy training. Could you give an example of what kind of training they received in cognitive behavior?
Sure, yeah. So they actually went through, and I don't remember the exact module, or the exact number, I'll be honest, but there are several modules that they walked through with different strategies for how to self-regulate emotions, identify emotions. Like I said, I don't remember all of the specific modules, but just really walking through different self-regulation and self-identification kind of techniques, because ultimately that's the goal of CBT or cognitive behavior therapy, is to help people to become their own kind of therapist so that they don't require an outside person to kind of prompt them.
So the teachers is learning strategies that they can help the children to self-regulate what they're feeling or how they're behaving.
Exactly. And a lot of like actual practice, like I remember there was one, and it's kind of awkward when I was here in a room with a group of EAs, but practicing like breathing techniques and different things with, stuffed animals or that kind of thing. But yeah, really practicing strategies that then they can teach kids and apply in their classrooms.
Thanks.
This seems great. I guess the question I'd have, just looking at this as a grant, are you seeing the benefits from the grant and from the program you expected? And are there any roadblocks in the way that you're hoping to go through for the second semester here or next year?
Yeah, I think that, this was a 1-year startup grant, and we actually received a significantly higher amount of money than we anticipated. This sounds so strange to say, but spending the money within the confines of the grant appropriately has been a little bit of a challenge. We're definitely seeing the benefit, I would say more so from our
more specific visits from SIPs, for example. So when they can come in and really provide teachers with very specific modeling and feedback, that seems to be more readily applicable than, training that people had in August. I feel like in hindsight, the training that we had in August was a lot of information in a really short period of time. So we've needed some help with, just how do we get from this sort of theoretical into our classrooms to really make that usable for kids. But we have plenty of money to keep.
Well, it sounds like you're learning some lessons too, that will hopefully adjust how you use money going forward to
For sure.
use it to effectively have some good benefits.
So I have a really basic informative informational question and then a longer question. Which schools has this been implemented in?
So it's all of our elementaries. So
Okay.
Edwards, Fellows, Meeker, Mitchell, and Sawyer.
Okay, and also in the preschool?
We have we invited both preschool and middle school staff to attend some of the trainings, like the CBT training, some of our ongoing, meetings, less formal meetings with SIPs. We don't have authorization, because it wasn't part of our grant application, to purchase things specifically for the preschool, because our grant was for for K-5.
Okay.
We probably could for EK if we had a need there. It's not something that we've done.
Okay. Have you thought about how this will be sustained in the future when the grant expires at the end of June?
Yeah, and so our hope right now, fortunately, we have a fair chunk to work with for obtaining, like the physical materials. So things like books and curricular materials for, specific SEBH concerns, or sensory materials to build sensory rooms and things like that. So, those things are helpful. Or if we need specialized furniture, like weighted furniture and that kind of thing, that's pretty expensive. And not a common need in the school. The training component would be the trickiest part.
Right.
Being able to continue to contract with SIPs or another practice to be able to provide that really targeted, sort of embedded professional development could be a challenge that we face in the future when the funding runs out. Now, hopefully, we'll be able to retain enough staff who have had that extensive training that they can carry on some of the things that they've learned and become mentors and things for new staff that we bring on.
Just to comment on the difference between a state grant and say the federal money that we were just talking about. So federal money is always a reimbursable. We spend the money and then we ask for reimbursement, and those deadlines like the June of 23 and the June of 24, that's when the money's no longer available to ask for reimbursement. On a state grant, and in particular in this one, they just send us all the money ahead of time. And so it just stays on our books until we get it spent. They're not going to come and say on June 30th, say, you have to give us back everything that you didn't spend, especially when they gave us, 3 times what we had asked for in our grant, something like that.
A little over twice.
Yeah. And so I think we're going to have this for a couple of years at least. It was supposed to be a planning grant, but I'm not sure if we got more because not as many school districts applied for it and they had to get the money out. But so there's a little bit difference between a federal and state grant.
Okay. Can I just clarify one thing you said? Because you said spending it, I think you said this. What I heard you say was that it's not the amount of money, it's how to spend it. And you could spend money on training, but it's implementing it in the classroom or taking the training and really using it in the classroom. That's the transferring of it. And is there money to help with the implementation of it? Because that is really critical.
Yeah, and we can use, and that, I think that's, kind of in response to the previous question, I think that is one of the lessons that we've really taken from this, is that's, that we know from teaching kids that practice place is such a sweet spot, right? That's a sweet spot for our staff too. And so really making sure that we have highly trained professionals that can come in and support that guided practice for our staff, I think is kind of one of the major things that we've learned, is that's where we need to focus our spending, more
Right,
so
thank
than
you.
front loading a lot of, yeah.
Any other questions on the therapeutic classroom grant? Right, thank you. Then we will take any comments from the public on our teaching and learning update.
Good evening. I need a little table.
You got your hands full.
Jenkins, 4810 Dover Drive. Good evening. Thank you, Dr. Hawkins, for your presentation on the ESSER funds. I just had 3 comments, things to think about, particularly when you look at the requirements, the 4 requirements for how the funds are spent. I think it's the last requirement that says you particularly are being asked to focus on certain groups. I guess when I look at the presentation, it's unclear how that's happening. Particularly, it's the data as presented are difficult to interpret from my perspective as a community member. So when I look at the data and the charts in particular, so just looking at the slide on, I think it's slide number 7 in the presentation, you have a list that tells me how many students were served. And then you have number of, I assume it says SOC, I assume that students of color are served. And then you have low SES, and then you have IEP, and then you have English language. So if you've already told me that you've served 25 students of color, are the 19 low SES then all white students? And then you tell me you've served 4 IEP. So are those white students who are not low SES? And then you tell me you have 5 English language learners. Are those white students? It's not clear, right? So it would be helpful if you could disaggregate the data in a way that communicates who's actually being served, because there's, as you know, intersections in those identities. When you look at the numbers of the students being served, again, I don't see the focus primarily on the students who are called to be served in requirement number 4. I actually see those students lowering in number every category you go down. So I'm just confused about that. And then finally, the slides around edgenuity are horrifying. 64% and 38% pass rate is just beyond pitiful. And I guess my thought is, I'm wondering about if the district is aware that continuing to use edgenuity is your complicity in structural barriers, right? I mean, I recall how we got to edgenuity. It wasn't a well thought out or well planned process. It was we've got to get something done. And that was after the community had been complaining about edgenuity for months. So my daughter is in an online public school. There are people who engage in online learning in all kinds of communities. I don't think it's the modality. I think it's edgenuity. And so I would just encourage you to reconsider continuing that, especially if we know we have more people coming in, and really think about it, not only from the perspective of creating these structural barriers, but also that, we're paying for this, right? We're using taxpayer money to pay this for this program that clearly isn't working. So thank you.
Thank you, Monique. Anyone else in the room who would like to speak on the teaching and learning update? Okay. Then we do have one Zoom participant, Angela Shaw, and you have been given permission to speak.
Hello, everybody.
Hello.
Angela Shaw, 5411 Tennessee Street. And today, like always, I asked the board to hold the district accountable. I sat in the educational equity group meeting just at 4 o'clock today, where we once again looked at the data and showed that 44% of Black students in the district are proficient in reading. 44%. And today we have data that shows that this population, along with Hispanic population, and all of this are not being targeted with the resources. When we went to our breakout session, our group said, what is the number one barrier? The number one barrier we said was the district's fear of putting targeted resources towards these groups. We know the data for years has shown that these specific groups need additional tutoring, need after-school programs, need this additional educational nudge. But the barrier isn't, I believe, with the families and all of that, it's the district. I believe you need to look in the mirror and really assess that. Also going off of the edgenuity, why are you even talking about it? 38%, 68%, it should be discontinued at this point. Not another taxpayer dime going into it until Edgenuity comes up with a solution. This is a partnership that's occurring, and now we're creating additional educational gaps. We're going to have reduction in graduation rates, reduction in reading, math, social studies. Every additional semester, we put Edgenuity into it. So I call the board to action. Why aren't we doing more for these targeted populations and not allowing fear to dictate how we operate the school district? Thank you for your time.
Thank you, Angela. Any other comments from the public on the teaching and learning update? Okay, then we will move on to our emergency management plan. Kathy Arnold.
Hello again. I'm excited to be able to share some COVID adjacent or maybe even non-COVID information with you tonight. Dr. Hawkins and I are here to talk about our emergency management program here at ACSD and give kind of a 50,000 foot view of that program. I think first, most people when they think of emergency management plans immediately think of active shooter drills. And I just want to clarify that it's just so much more than that. Emergency management is the systems and practices to manage many different emergencies. So keep that in mind when you're thinking of this presentation. To start on our first slide, I thought it'd be good to give just a general description of the different phases of emergency management, and then in more detail, share examples of how we're doing that here. As an overview, the first phase and second phase are often done in combination together. So prevention and mitigation. Prevention is the actions to avoid, deter, or stop something from happening. That combines with mitigation when you're looking at how, if something's happening, how are we going to lessen that impact? Preparedness is what we do to safeguard our students and staff from an emergency event. Moving on to response, that's if something actually happens, how do we respond to it? And then finally, recovery, what do we do afterwards? And you'll see it's a circle, right? As we go back around and we start back again. If something happens, what do we do? How do we learn from that? Do we do a little after action debriefing and figure out how we do it better next time? On our next slide would be in our prevention. So in prevention here at ACSD, we've got various ways that we do prevention. One, through staff training, some of which was even mentioned tonight. We do have ALICE training, CPI or crisis prevention intervention training, that de-escalation training, first aid training, using how to use an EpiPen, what happens if someone has a seizure. All of that helps us to prevent or be prepared if an event were to happen. Additionally, we have an anonymous alert system that was launched in January of 2020. As could probably be expected, anything launched in January 2020 probably needs a little bit of a refresh right now. So we will be relaunching and refreshing that in February of this year. It's not that the system is gone or has gone away, but just to re-energize that, make sure it's set up and working the way it should. And then finally, just community partners meetings. As I mentioned before, and I mentioned this usually in the COVID updates, I meet regularly with community partners, including emergency managers from Iowa State, Mary Greeley, the city, and Story County. And we talk about things with COVID, but we talk about things outside of that, as well as some planning for maybe some future drills that we may be doing in collaboration. Next area is mitigation, and I'm going to start this and I'll pass it over to Dr. Hawkins in just a moment. As far as mitigation, again, that preparedness still kind of in that same realm. So it's an example that we're doing, storing emergency supplies. When we knew that we were going to switch the type of masks that we were supporting, we moved towards the procedural paper cloth masks in December. We ordered those. It's actually time to order some more because I know at least at our high school, they're going through about 2,000 a week. So it's making sure that we're looking at what strategies and what things that we can do to support that. Identifying safe rooms. That could be for an event like a threat, but it also could be simply thinking of a tornado, a derecho, something like that. Where are our safe locations? So that's a form of mitigation. And then finally, looking at some of our non-structural and structural mitigation. And this is things that fall under Jerry Peters, perhaps, areas when we're looking at building the new high school. What are certain structural things that we can do that are better than our current high school? What are some non-structural things or less permanent? So we're not going to build a new building, but what can we do in our current building to make it more functional and safe? I'm going to turn it over to Dr. Hawkins to talk a little bit more about some of our mitigation.
So my portion of the presentation to the board is the opportunity. You heard Dr. Arnold talk about community partnerships. She talked about some debriefing and then some training and strategies. Dr. Vincent and I had the opportunity to do a community partnership meeting with the City of Ames and the Ames Police Department to talk about some of the ongoing partnerships that we would have in this area of emergency management. And if on the next slide, it's going to detail several of the things that we discussed that will be part of an ongoing plan. I would say anecdotally, I think all of us left that conversation feeling really good about the continued partnership, the increased communication strategies that we'd identified, some of the training strategies that I'll talk about here in a second, including different evaluations. They offered to do what's called a CEPTED evaluation of our new building. It stands for, I believe I have it written up there, crime prevention through environmental design. It's where they look at the design of a building and they offer strategies and suggestions for either prevention or reduction of potential issues of violence or safety. And so they've talked about that. We talked about collaboration around mental health resources in our community and supports. The city and the Ames Police Department are very willing to work with us on some active threat assessment. Some active threat training. So how do we deal if we have an active threat on campus and get some expertise and advice? They're also willing to work with us on being a part of a threat assessment team. Also, some initial inquiries right around March of 2020. There is some training out there. When a threat occurs, how do we assess that threat for its validity? And then how do we direct the right resources to help support people through that, particularly anyone who might have made a threat? Again, the police have gone through that threat assessment process. They have some protocols that they are willing to share with us. The district is going to continue to look into getting some training as we did pre-pandemic around threat assessment. And one of the strong practices that would be suggested is that we form what's called a threat assessment team. The police have indicated that they would be willing to serve on that team with us. We talked about relationship building strategies between building principals and the officers that will be on the day patrol, so that if our buildings were need to call someone to the building, that they have some relationship, potentially knowing the people that will come to the building. We also discussed communication strategies back and forth between the district and the PD, right? So oftentimes now we might have like a school resource officer that would offer information about this is what's going on in the community, and so it might impact this child's life this way. We discussed partnerships and ways to communicate post SRO as to how we might be able to support kids with information that we wouldn't have without that communication. So I think I addressed all of those areas there, but and to be quite frank with you as a board, as I looked at the rest of the presentation that Dr. Arnold provided, I know that we listed this under mitigation. It really hits probably those first three areas of prevention, mitigation, and preparedness. But I guess what I'm hoping that you'll hear from me is the excitement from me around the relationship and the partnership that the city and the police want to have with us in order to help address these portions of our emergency management plan and the safety of our buildings.
Thank you, Dr. Hawkins. Yeah, there's a lot that can be combined, especially among the categories. They're not linear, they're like clear-cut points with that. The next slide discusses preparedness. One of our requirements as per Iowa code is that we have to have a high-quality school building emergency operations plan. That has been in place since July of 2019. It was developed in collaboration with district personnel, county emergency management, fire, law enforcement, public health, mental health service providers, and other community providers. We updated that plan in December 2021, and that plan is required to be evaluated by the board on an annual basis. The board will receive a detailed plan. That plan, though, is confidential because it includes a lot of information that if everyone had access to it may compromise the safety of the items that are in that. It outlines the expectation of our faculty, staff, administrators, parents, and guardians if there was an emergency, sets out our internal and external communication plans, talks about specifically what types and frequency training that we need to provide, delineate some chain of command for if we have to bring in an external support from fire or from law enforcement and how that chain of command is supposed to run. And talks about reunification places. So it's a very detailed plan that is set up to try to address most situations that we may face. Next slide shows kind of incident command as an org chart. This is a very common, not limited to schools. You may have seen this in other environments you've worked, but the incident command structure is what is frequently used in an emergency. It is scalable depending on what type of a situation you're facing. So you might have a situation, I'll give some examples, where most often for our district, Dr. Vincent would be our incident commander. But it could be at a building level, a principal could be the incident commander, or even the school nurse could be an incident commander, depending on the particular situation. So it is that decision maker. Here's just a simple example on showing the scalability of it is, let's talk about a snow or weather emergency. If a situation occurs where we have an anticipated snow event on the evening, it's supposed to be snowing overnight, right? There's a forecast, we know what's coming up. In that example, Dr. Vincent being the incident commander, Eric or his designee would be our communicator or public information person, and the safety officer or content expert would perhaps be Jerry Peters, who's going to talk about our snow clearing practices, how long is that going to take. That group would individually meet and be incident command. They may make a decision to say, okay, we may cancel, we may delay based on that small group. Now, if the same situation were to happen where we had an unanticipated weather event that happened at, 11 o'clock or noon, where we had students in the buildings, where maybe we had a derecho that we didn't have advance warning of, where we would need to have more people, right? We would still have an incident commander. We would still have an information officer. We would probably still have our, maybe a couple of our safety experts. But Dr. Hawkins would probably serve as our liaison with the buildings. We're going to need those logistics people. We're going to need the operations doer people. And I love the terms that are on this slide. I found it in a school adaptation of emergency response, because it really tells what those positions are for and what they do. And so that it's going to change based upon an emergency. Both are weather emergencies, but it depends upon the severity and scope. Next slide that I have shows what our current emergency response communication plan is. There's definitions and instructions under each specific category of a reminder of what to do in case of that specific emergency. And when emergencies happen, it's very nice to have something very simple and succinct that says, okay, if this is happening, this is what I do, and this is available, obviously, for our staff. Part of this in the communication plan, and this is not new, this is something we've had, but the one piece that we haven't talked about a little bit is how parents can best help us when there's an emergency. And so you'll see on the next slide, I've adapted some information from Pittsburgh Public Schools on what parents can do to help in a case of an emergency. First, stay calm and alert. Seems pretty obvious, but sometimes that's probably the hardest thing that we can ask people to do. Parents being an essential partner or to help keep our schools safe, but panicking is not going to help anybody, right? Next, and probably the next hardest thing, do not come to the school. If we're having a true event and it's not a weather emergency, we need you to come get your children before it starts snowing. But if we're having some type of an internal threat, the hardest thing to do is to say, stay away. And that's because if we do have an event happening and we do need to get emergency personnel there, if we have lots of parents blocking the way, those emergency responders will not be able to get to the building, and there could be negative outcomes because of that. Don't call the school. Also a hard thing, right? But the more phone lines that are being occupied with people calling and worrying and asking questions, it's taking focus away from the particular situation. Some good recommendations that were shared if a child texts or calls a parent. Again, stay calm, stay reassuring. Encourage the students to follow what the school staff are telling them to do, and also ask them to refrain from posting things on social media during an event. Again, this is a safety thing. Sharing certain things, sharing locations, sharing plans can actually be more dangerous and put more people in danger in a threat situation. Wait for further instructions, and also another big one, refrain from sharing misleading or incomplete information. One of the things of having cell phones and everything at our fingertips is we can look up the answer to everything. We can Google just about anything you want to find out, and so we're used to that. We're used to that constant feedback and constant response. So in this situation, it's the same thing. You want to know, and I know something, so I'm going to share that. Unfortunately, that can lead and cycle into more panic, more anxiety, and again, perhaps impede a situation that's currently unfolding. So very hard things to ask, but that's how best our parents can partner with us. The final slide just talks about recovery. And this part of emergency management could be includes short-term things like implementation of grief counselors or mental health professionals after an event. It could be cleaning up the snow, right? That's part of recovery, is getting back to where we can go to normal operations. Long-term recovery, that's where we look at those after action and debriefing meetings, where we in-depth review what happened, what worked, what totally didn't work, what can we do better next time, and evolve that process. And specifically, it's really important even on small things to do those debriefings, because more people you have to get feedback who were impacted in the incident will help in the future. That is the very quick 50,000 foot view of emergency management. What questions can either Dr. Hawkins or I answer for you tonight?
These recommendations for parents, are we communicating those to parents?
I was sharing them obviously with the board first, but we have talked about different communication strategies for that.
Yeah, I think some of the explanations you give to give context to that, like why you should not come to the school, to help parents understand that it's safer for your kids not to be there, might be helpful, and social media and all that too, obviously.
Yeah, I think that it's just to reiterate what Director Winfrey said. I think it's really important to give the explanation. I think that if you'd give just this list of tips without the explanation, it may go poorly. But with the explanation, I think it makes sense.
Agreed, and I think that a lot of it, because it's opposite to what the internal human being wants to do.
Right.
Internally, I want to go protect my child and I will go grab them out of school myself and pull them into my car. However, you have to kind of work against those. And so, yes, that would not just be a list. There's, there would be definitions and a little better explanation and examples for that as well.
There's probably an intersection with that too, to intentional use of that alert system. I think that was one of our pieces in the debrief from earlier in the school year. A way to use that helps to build that confidence over time, that people will be informed to the extent that we can, could probably help with some of those things.
Yeah.
I'd say relating to that, maybe the slide before with the shelter in place, hold in place, and lockdown, and what that means, making sure that as something's communicated to the parents, those terms are continually described, because to a parent, those three sound very similar. So making it so communications that use those terms actually then go on to have the sentence about what it means, I think would be very helpful.
I think what I would add to that, because I was going to say the same thing, Dr. Beerbaum, but within it, it tells students what to do. So if a parent receives an email or however the communication comes, you know what your student is being told to do at that moment.
I want to bring something else up, so I'm just waiting.
Oh, is it related to this?
Yes.
Okay.
Yes.
I had one other thing too. I was waiting also. Go ahead, Michelle.
You mentioned that you're relaunching the Anonymous Alerts program. In your relaunching, are you reviewing the process for handling those types of alerts, depending on what they are and who's receiving them? Have you made any significant changes in that regard?
Honestly, no. It was what I was going to focus on earlier this month. However, little Omicron kind of directed my focus a little away from where I wanted to be so far on the anonymous alerts. So, but it's going to be a full review of the process and mapping out how that works and making sure we have a clear of how to handle and to make sure also that things are being followed through with as well.
Yeah, because there can be some really personal and sensitive information that's shared on that may be about just a single person. So we want to just be very careful with that information. Thanks.
If I could, I would say that the way it was initially set up was that the people who would have access to that were a very limited group, primarily school counselors and school administrators. And so I would agree, we would want to continue to have a very limited access to that. But in addition, then we need to figure out what's our protocol for ensuring if 4 people have access to receive an alert. What is our protocol for documenting which of those 4 is going to take that lead and then follow up to resolution of that?
And what those steps are with the information.
So my only other question, I was taking what you said as that you are developing, when you said an emergency operations plan, I'm assuming that's something printed and that will be kind of where all of this is shared out with staff and students and families. Is that accurate?
Well, yes and no. There is an emergency operations plan, which is that confidential document that covers all of the details.
Okay.
There is also, we have other strategies. So just to be clear on what, there are certain things, yes, that are being developed and shared, but our true emergency operations plan itself is not going to be shared.
So that would just be for staff, the emergency operations
Not
plan.
even necessarily just staff, but incident command
Incident,
and
okay.
leadership.
Okay. So I know that we already kind of talked about the communication, but is there a strategy or have you not gotten that far with, packaging this information in order to communicate it out to families?
We're working through that.
Okay.
We do have we have flip books that are available that describe the different things to do in cases of emergency. So there are elements of our plan that can be public or more accessible to staff that are already there. They just need to, again, some of that needs just some refreshing. And then yes, we're working through that as well. We wanted to give first the plan to the board first.
Thanks.
So to make sure I heard correctly, you updated the plan last month? Okay, and we're expected to review it annually? And I guess I will be told when it's my turn, when we're going to review it. Yeah. Okay.
So is staff actually trained in ICS? Like, are there
Members of
incident
Incident
types
Command,
and
yes.
SOPs and all of that that staff are trained and go by playbooks on?
Our administrative staff.
Those who would be directly in the incident command, yes.
And the flip books you're talking about then are basically standard operating procedures following out of that? Cool.
Things like fire drills, tornado drills, I mean, the very common things. That information, of course, is already in place.
Okay, thank you, Dr. Arnold and Dr. Hawkins. Do we have any comments from the public on our emergency management plan? Okay, seeing none, I will go ahead and open our public forum and read our statement on public comments. Residents of the district, students attending the district, parents or guardians of students attending the district, and district staff members may address the board about any topic relevant to the district, whether on the current agenda or not. Those who wish to speak must sign up at the beginning of the meeting. Speaker participation is limited to 3 minutes once per item. The views and opinions of citizens addressing the board do not necessarily reflect those of the board, district administration, or staff. Speakers are to remember that Iowa law prohibits the board from discussing specific employees, students, or their performance. Student speakers will state their name and school. Others will state their name and address. We do not have anybody signed up on either the in-person or virtual public forum. So I will go ahead and close our public forum and we will move on to our consent items, and I'll entertain a motion.
I move approval of consent as presented.
Second.
Moved by Franzen, seconded by Beerbaum. Superintendent Vincent, gifts to the district.
Yes. This evening, we have multiple gifts to the Hope Pantry. And those individuals or groups would be the ISU Hindu Yuva, Ames Women's Club, Ryman Gardens, Jill Janes, Justin and Julia Peters, and Mr. and Mrs. David Williams. We have additional gifts from the Lutheran Church of Hope of Ames for the Backpack Buddies, and also an anonymous gift for the Lunch Hero program. And once again, our sincere thanks to all of these individuals and groups for continuing to support our schools and students in all of these ways.
Thank you, Dr. Vincent. It was moved by Franzen, seconded by Beerbaum to approve the consent items. All those in favor say aye. Aye. Opposed, nay. Passes 7-0. And we will move on to our action items, the first of which is our policies for action.
I move the board approve the policies as presented.
Second. Moved by Franzen, seconded by Linkaitis. Discussion? All those in favor say aye. Aye. Opposed, nay. Passes 7-0. And next is our ESSER 2 funding request to the School Budget Review Committee, increased preschool enrollment.
I move as part of the district's response to the impact of COVID-19 pandemic, the district administration is authorized to submit a request to the School Budget Review Committee for funding related to FY22 SWVPP increased enrollment in the amount of $119,245.50.
Second.
Moved by Beerbaum, seconded by Becker. Discussion? All those in favor say aye. Aye. Opposed, nay. Passes 7-0. Modified allowable growth request to the School Budget Review Committee, Woodward Academy Day School Consortium Special Education Administration costs.
I move with the board authorize the administration to request from the School Budget Review Committee modified allowable growth in the amount of approximately $1,755.64 for special education administration costs at the Woodward Academy Day School Consortium.
Second.
Moved by Linkaitis, seconded by Franzen. Discussion? All those in favor say aye. Aye. Opposed, nay. Passes 7-0. New high school construction project change orders.
I move the board approve the change orders for the new Ames High School construction project as presented.
Second. Moved by Beerbaum, seconded by Smith. Discussion? All those in favor say aye.
Aye.
Opposed, nay. Passes 7-0. Superintendent's contract.
I move the board approve a 3-year contract with Dr. Julius Lawson as superintendent of the Ames Community School District for a beginning compensation of $239,500.
Second.
Moved by Franzen, seconded by Beerbaum. Discussion? All those in favor say aye. Aye. Opposed, nay. Passes 7-0. And we will move on to our board and staff items. And so I guess I will start with, with saying we have completed our superintendent search process. We are really thankful to HYA for being an amazing search firm. They brought us amazing candidates. We had great community participation throughout the process, including those who were able to participate in the small groups that met with our candidates last week. And we are incredibly excited to welcome Dr. Julius Lawson to Ames starting in July. We can all share that he's extremely excited to come and can't wait to get back here again. So we will hopefully have some dates coming up soon where he can get back here and meet more members of the community. Anything else from the board? All right. Request from staff. I do have the request for additional data. I can follow up with you, Dr. Hawkins, make sure we're clear on what is needed there. And items from the superintendent.
Well, first off, just congratulations to the board. I don't know if the community understands just how many hours you put in this fall to make this happen, but you could not have hit a better window, and we're already hearing across this state and neighboring states the challenges schools are finding with candidates. So the fact that you moved quickly and efficiently and with a result that you're so excited about, kudos. So that is awesome. Second, thanks to all of you for allowing us to kind of embed some of our typical onboarding items into the regular board meeting because you were otherwise occupied. We have had a pretty heavy agenda for you. And staff also, as you notice, have developed pretty comprehensive reports in some of these areas because it is new for part of the board members and it keeps moving. So we certainly appreciate that opportunity to hit those major topics. In February, we do have a work session at that first meeting, and it is the group that has contracted with the district. I think this will be maybe their second or third year on the demographic study. They are ready to come, and so that will be the work session that's scheduled at this point for February. I believe it's 7th. Just a reminder on the legislative item, we are in the legislative time frame, and there are plenty of things moving. Any of you that want to participate with the Iowa Association of School Boards, that's always a very informative day if you can get away for that opportunity. And the registration information was in your board update, and I think also you received an extra email for that. Finally, I'm excited. It's a minor thing, but some staff worked really hard to respond to our community request for being more transparent with our data, and we will be highlighting that on the website. It went live today. It's a beginning. It's a placeholder. It certainly probably needs refinement, but there is a link there for data that covers several different areas. I would just say to you, don't hesitate to keep clicking because it is layers deep, and it does get into some of this disaggregated data, as well as some finance data and other sorts of things. And we hope to see that just build over time as we will transition at some point over the next many months into a new website and be able to bring some of that data forward with us. So, thank you.
All right, thank you, Dr. Vincent. Our board planning calendar is our next item. We will have regular meetings February 7th and 21st, and as Dr. Vincent said, we will have a work session on February 7th. Any other items on the board planning calendar?
I move we adjourn.
Second.
Moved by Beerbum, seconded by Franzen. All those in favor say aye.
Aye.
Opposed, nay.